Good evening, guys. We're discussing for D. Discussion D deals with adult daycare services for seniors whose families are working during the day. It's a chance for them to drop them off adult daycare. So I'm going to dig into that for you for discussion D. So please join me in today's discussion D, adult daycare. Let me get organized. I'll be right with you. Okay. So this is to explain what adult daycare is for folks who don't normally deal with this, who are new to the term. So I'm going to go through this presentation for you. So please join me for today's discussion D. Okay, here we go. The page breaks down 3 distinct types of adult daycare, each designed to meet different needs for older adults and their caregivers. Okay, number 1, social daycare, focused on engagement and enrichment. These centers foster community through activities like arts and crafts, group sing-alongs, and discussion groups, gentle exercises such as chair yoga, mental stimulation through games like bingo, celebrations and local outings, and numerous meals and snacks. Okay, they also offer transportation, social services, and light health checks, ideal for seniors who are socially isolated but don't require intensive medical care. Okay, second adult daycare explanation, guys, is adult day health care, or ADHC, for older adults with medical or therapy needs. These centers provide skilled nursing care and monitoring, physical, occupational, and speech therapy, mandatory health assessments prior to admission. Okay. ADHC programs often support participants with complex conditions like stroke or dementia. Some operate under PACE program, which is an all-inclusive care program for elderly. Okay. Okay, I'm offering a full continuum of care while enabling seniors to stay in their home. 3, Alzheimer's and dementia daycare, tailored for seniors with cognitive impairments. These programs feature secure environments, to prevent wandering, specialized trained staff in dementia care, activities adapted to participants' abilities. Okay, the focus on safety, structure, and maintaining dignity through individualized supports. Each type supports caregivers by offering a safe, structured place for their loved ones while allowing time for work, rest, or personal needs. Choosing the right one depends on the social, physical, and cognitive needs of the senior and what kind of respite the caregiver is looking for. Would it help if we compared these care types based on your area or someone's specific condition? Each type of adult daycare offers unique benefits tailored to an individual's physical, cognitive, and social needs. Here's how they compare. Main benefits: emotional well being and social connection, engages socialization, reducing loneliness and isolation, stimulates cognitive function with group games and discussions, enhances quality of life through creative and recreational activities, often includes services like transportation and light healthcare checks. This setting is ideal for individuals who are relatively independent but thrive with structure, companionship, and a sense of purpose. Okay, adult daycare health care, ADHC. Main benefit: clinical oversight without institutionalization, provides medical support like nursing care and therapies while allowing the person to remain at home, assists with managing chronic conditions such as diabetes, stroke, or frailty, promotes functional independence through rehabilitation services, offers comprehensive care planning, sometimes under programs like PACE. ADHC is especially beneficial for individuals with multiple health needs who require daytime medical supervision but not full-time residential care. Alzheimer's and dementia daycare. Main benefit: cognitive safety and person-centered care. Creates a secure, structured environment to prevent confusion or wandering. Supports preserved abilities through carefully adaptive uh, activities. Provides specialized staff trained in dementia communication and care techniques. Maintains dignity and autonomy with routines that respect individuals' preferences. For people with cognitive decline, this model offers meaningful engagement while safeguarding their well being and gives caregivers reliable respite. Would you like help mapping these options to real programs in your area or exploring how they intersect with memory friendly design or frailty aware innovations? That's well within your wheelhouse. Tailoring adult daycare to specific conditions means blending therapeutic and intent with personalized structure, meeting not only just medical requirements but emotional and cognitive needs as well. Here's how each type adapts based on conditions. Okay, social daycare, ideal for mild cognitive decline, depression, or isolation. Cognitive conditions like light activities like remembrance therapy or music can gently uh, stimulate memory in early stage dementia. Mental health, routine social interactions helps reduce anxiety and mood disorders. Mobility or frailty concerns. Adapted exercises, e.g., chair yoga or Tai Chi, balances stimulation with safety. Customization. Activities can be grouped by interest or cognitive level to prevent overload or uh, dis disengagement. Okay. Adult day health care, best for stroke recovery, diabetes, Parkinson's, or frailty. Okay, I'm going to go through those for you. Neurological rehabilitation. Stroke survivors receive tailored physical and speech therapy in structured non-hospital settings. Chronic disease management. Nurses monitor vitals, manage medication, and assist with insulin or dietary needs. Motor disorders. Parkinson's participants benefit from therapies that improve coordination and mobility. Customization. Health teams develop personalized care plans based on doctor referrals and regular assessments. Alzheimer's and dementia daycare, designed for moderate or severe cognitive impairment. Memory loss environments are simplified and secure to support routine without triggering confusion. Behavioral issues. Staff are trained in redirection techniques and calming approaches for aggression or wandering. Caregiver stimulation or cognitive stimulation. Familiar activities like sorting, storytelling, or sensory sensations supports preserved abilities and reduces distress. Customization. Activities and meal plans are aligned with retained capacities, cultural preferences, and individual history. Okay. Holistic tailoring also means incorporating cultural sensitivities, trauma, trauma-informed care, and family preferences, especially crucial when conditions intersect, like dementia with mobility challenges. Given your expertise in frailty aware and memory friendly environments, would you like to explore design strategies or program evaluations for these care settings? We could even sketch out what a hybrid day care model might look like. Overlapping needs, program evaluations in adult daycare settings rely on both quantitative data and quantitative insights, helping providers improve services while ensuring safety, effectiveness, and satisfaction. Here's how it usually is done. Okay. Number 1, client outcome tracking. Focuses on health, behavior, and engagement over time. Functional assessments, mobility, cognitive ability, and self-care using standardized tools like Barthel Index, or a mini mental state exam. Goal alternative scaling evaluates whether personalized care goals are being met. Cognitive stimulation impact tracks improvement or stabilization in cognitive tasks through regular activity-based testing. Caregiver and participant feedback gathers perspectives or shape a person-centered care. Surveys and interviews. To assess satisfaction, cultural responsiveness, and emotional well-being. Focus groups with family caregivers to reveal unmet needs or barriers to access. Advisory committees that include participant voices for ongoing program refinement. Clinical and compliance adults ensures standards. The best practices are maintained. Reviews of medication logs, therapy records, and health assessments for regulatory adherence. Monitoring care protocols for chronic conditions or post-acute rehab, especially in ADHD and dementia specific settings. Certification inspections by state or accrediting bodies like CARE-F, Commission on Accreditation of Rehabilitation Facilities. Operational and financial analysis looks at sustainability and equitable access. Cost effectiveness analysis, how much benefits per dollar spent, especially in hybrid care models. Utilization rates, attendance trends, and wait list data to manage capacity and workflow reviews to ensure staff roles and programming align with participant needs. Environmental and program design reviews assesses how well the space and structure report dignity and function. Evaluations of sensory friendly and memory safe layouts and dementia focused programs. Checks for adaptability and exercise, nutrition, and wellness programming. Feedback informed reassign of activities, meals, formats, or group sizes for daily aware support. Given your strengths in frailty assessment and memory-friendly design, you might enjoy delving deeper into how these evaluations translate into built environments, innovations, or therapeutic programming standards. Would you like Definity? Here's several proven evaluation frameworks used in adult daycare settings, each offering structured insight into effectiveness, person-centered, and operational quality. 1. Interarray home care and adult day services assessment. Focus holistic client outcomes. Includes models for cognition, mood, ADLs, activities of daily living, and social engagement. Enables longitudinal tracking to support aging in place and care transitions. Used by Medicaid and long-term care networks for quality benchmarking. Why it works. It links clinical insight with support planning and flags unmet needs systematically. 2. Dementia care mapping, or DCM. Focus person-centered engagement for dementia participants. Observational tool developed by the University of Bradford. Monitors emotional responses and well-being in real-time interactions. Categorizes care quality based on effectiveness, effective states, and activity suitability. Why it works. It surfaces subtle issues like emotional distress or passive disalignment that a traditional adult miss. Okay, goal achievement scale. Focus, measuring individualized therapeutic success. Participants and caregivers set personal goals, improve balance and socializing, progress and scored in a 5-point scale from much less to much more expected. Common rehab oriented ADHC settings. Why it works. It honors what matters most to the participant, not just clinical targets. CARE F accreditation standards, focus, organizational excellence and safety, used across health and human services for performance and risk and mitigation. Includes standards for governmency, staff credentials, and care planning required by many insurers and funding agencies. Why it works. It promotes transparency and accountability across service dimensions. Eden Alternative Environmental Adult. Focus dignity and autonomy and sensory well-being. Assesses physical space for safety, flexibility, emotional resilience. Applies well in dementia care and frailty awareness settings. Uses storytelling in residential care experiences to guide redesign. Why it works. Bridges philosophy with measurable environmental impacts. Last page, guys. Something that aligns beautifully with your memory-friendly design interests. Would you like to sketch out an evaluation framework tailored for hybrid models, or explore how these tools interface with the smart technologies in care settings? We could even mock up a dashboard that tracks frailty medications or indicators and person-centered outcomes side by side to explore frameworks like the Eden Alternative or dementia inclusive audit tools. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. Until then, Gator Wellness, and take care, folks.